All right, good evening, everyone. I want to take this opportunity to welcome you to the Westminster City Council study session for August the 3rd, 2020. We have on our agenda tonight reports of the city council members, city manager report. We have 3 presentations tonight. The city's response to COVID-19, our Human Services Board funding recommendations, then a review of the city council budget. Following that, we have a request to meet with the city attorney to receive legal guidance on an item facing the city, and that will be an executive session that will be at the end of the meeting. So at this point, I will turn to the council members to see if any council members have any reports they'd like to make at this time. Mr. DeMott.
Thank you. I just wanted to follow up with council. I had sent an email in regards to looking like my name was dropped off of the CML, and that's one of my assignments. I did hear back from the city manager's office that they reached out to CML to have that corrected. So I just wanted to let you all know that the city manager's office followed up with me on that, and hopefully it's fixed.
Okay, anything else? Any other member of council have any items they want to update this group on? All right, seeing nobody else in the queue, Mr. Tripp, would you like to start with the city manager's report?
Mr. Mayor, I don't have anything else in particular this evening besides what's on the agenda, so we can move to the agenda if you choose to do that at this time.
All right, let's go ahead and go. If you want to start that one.
I will. I'm going to call under the COVID-19 update, Public Works Utilities Director Max Kirschbaum up. He's going to give a preliminary, some information preliminary to this evening's COVID-19 discussion relates to a weekly report that we provide to council on case numbers and that sort of thing. So Max, if you'd go ahead and start that, and then if you would, Max, go ahead and introduce Dr. Johnson after you're done.
Thank you, Mr. Tripp, and I will introduce Dr. Johnson after I present the slides this evening as an introduction to some of his remarks. The first 3 slides that I will be showing you tonight are slides that are very familiar to you, same slides we've been showing for the last several weeks, and you'll see at the end that as a result of our discussion last week, I added 1 additional slide for your review in this forum. Okay, so looking at the first slide, again, this is the 3-day average of positive COVID-19 using statewide data from the CDP-HE website, and this information is through August 1st. So we're seeing a little bit different movement in the data this past week. The previous 6 weeks, there was pretty much a consistent increase in cases. You could see a dip in that data once a week, usually corresponding with a weekend. But if you look at just the last slice of the last week, you'll see several days below the peak. These are about a week's worth of data where we start to see a little bit of a decrease. I'm not sure if I would call it a trend yet, but at least this week's worth of data looks fairly positive. Interestingly, you'll see as we go to the next slide, Matt, the same thing will be true with both Jefferson County data and Adams County data, or the Adams County portion of Tri-County Health data. So in the Jefferson County data, this is through July 31st. And again, you can see that there are several days focusing on the dark green line on that chart, which is a similar 3-day moving average. You can see there appears to be a bit of a trend developing over the past week of some of that data coming downward. Hard to determine yet whether that's a trend or if that's just a few days worth of data, but certainly seems consistent with statewide data. And if you'll go to the next slide, Matt, and we look at the Adams County portion of Tri-County Health, same thing. Here again, as I've said in previous weeks, their presentation of data is a little bit different. So scale-wise, it's a little harder to follow the last 14 days and detect a trend, but you see basically the same kind of a pattern over the last week with a downward movement in the 3-day average of positive cases again. You'll also see at the end of that chart drop off that's typical on this, the way this scale of data is presented, that usually corresponds to weekend and reporting. So again, from these three, I wouldn't get too quick to draw conclusions, but they are consistent between the three, and that's useful. And then the last slide, this is the slide we talked about adding last week, where the vertical bars correspond to the left vertical axis, which is the number of tests conducted, not positives, but the total number of tests. The aqua and the tan colors represent the commercial testing and the CDPHE testing, respectively. And you can see over the data that ends with the week of July 26th, that it was nearly an average of 80,000 tests per day over that week period. So each bar represents an entire week in this case. The other piece of that we discussed would be useful information to present is the positivity rate. If you look at the red line on that chart, what we've been saying for the previous 6 weeks is that from about the 15th of June, there was also a slow but steady increase in the positivity rate, whereas it had been down to a low of in the low 2.0 type numbers. We were at, in the previous week to this one, we were at about 5%. And what you see from the second to the last bar to the last bar, a drop of a full percentage point to 4% positivity rate in this data in that week that is represented by that final bar on the right-hand side. So again, this seems to correlate with the 3-day moving average of positives in the other data that we looked at for the state, for Jefferson County, and for Tri-County Health, Adams County portion. So those are all, it's useful that they are trending similarly. I would just be cautious about drawing a conclusion yet. And I'll conclude by saying, and as a result, as a city, we'll continue to remain on a pause for reopening of additional facilities. That said, though, we have not shut down or curtailed yet any activity or facilities that have reopened. So steady state in that regard over the last week. And that concludes my comments unless you have any questions.
Max, Mr. DeMott has a question for you.
Thanks for adding this extra information. Two of the other, well, a couple things I'm curious about on this graph here. With the positivity line is the red, correct?
Yes, that's correct.
And so the testing numbers, how do we know that positivity rate when it's really spiked up in April with the tests being less than the positivity? Are those presumed positives? And do the presumed positives follow that curve throughout where the testing is?
Well, I think in the early phase of the pandemic, it was a factor of the only tests that were conducted were those who were very symptomatic or had a specific medical reason to get the test. So it's not a surprise that positivity rate would have been very high, up around the 20% range. Whereas now, where, we were, like we just said, an average of 80,000 tests, you would expect that that positivity rate to be much lower. And it's good that we see a full percentage drop is rather significant the way that data is presented.
Okay. The other thing that two other things that I'd be curious about, if maybe you could in the future present it to us. I had recently asked for, we get the daily updates that have actual Westminster numbers on it. And I did get a spreadsheet and I appreciate it, but I'm curious if we could graph that as well in the same fashion that you've done this, where we could actually see through the same time continuum where Westminster has trended specifically as a city. The other thing that, and I did ask about it last time, and I'm not sure, I did go to the state and was looking at death rate and age of people who die from COVID. And some of that state data that you pointed me to, like we are talking 75% of people who have succumbed to this virus were 70 plus years old. And I brought this up last week. I think that's important for us to do. So if I don't know if you can add that specifically for Westminster, but at least if we could get a graph that shows Westminster's cases on the same kind of continuum that you showed us for the counties, I would appreciate it.
There may be a possibility of us being able to do that with Westminster Data. Our access to the Westminster data is maybe a little bit less than perfect, since we're putting together two pieces from the two different counties. I'll see what is possible for us to do, and we'll do that. I'm pretty sure I don't have that level of insight on deaths, however.
And if you don't, I understand. And on the Westminster one, even if it's not, I mean, you could, if you want to put it on there that we're not 100% accurate, I just want to see the trending levels.
Understood.
Appreciate it. Thank you, Max.
Any other questions from Max before we go to Dr. Johnson? Max, if you would, please introduce our guest.
Sure. Dr. Johnson spoke with you, time flies. I want to say it was in late April, early May. I don't recall exactly. He gave you a presentation at that time about what the county public health office and EOC were doing. Last week, you thought, in addition to the information that we were presenting here, it would be helpful to get another update from Dr. Johnson. He's agreed to be here this evening with you, and following these remarks, he can either correct anything I've misstated or highlight things of particular interest on the Jefferson County side. Dr. Johnson.
Thank you, Max. I appreciate that. And I don't have anything to correct on what you just presented. I would, however, add a caveat, and you touched on it, but I would probably make it a little stronger than you did. And that is that really the data that we have for the last 2 weeks is somewhat suspect in almost all of these graphs. And that is true in the best of circumstances, but in the recent past, where particularly the private laboratories have been overwhelmed because of tests that they're getting from Arizona and Texas and all over the country, we are having long delays in getting our test results back. And so for the last couple of weeks, we really don't have good data as to exactly what is the positivity rate, what is the total number of tests that have been done. We have been finding that on Fridays, usually we get a whole bunch of test results dumped on us, which we then have to go back and look at the onset dates and when was the test done and those kinds of things to try to make them fit into where they should be on the graph. But other than that, the graphs that you presented are very up to date and are cautiously, optimistically showing that we may be having a bit of a flattening off of the most recent wave of the curve that we have had here since 1st of March. Just a couple more numbers that I would add as far as Jefferson County and at least the Jefferson County portion of Westminster. Overall, we've had just over 4,000 total cases in Jefferson County with 2,207, let me say that again, with 227 deaths. So that we have a rate of cases in Jefferson County of about 6.92 per thousand in the county. In Westminster, we've had 244 cases in the Jefferson County portion for a rate of about 5.52 per thousand, so a little bit less than what we have for the average around Jefferson County, which is good. Over the last 2 weeks, we have had 56 cases from Jefferson County, and we have had 677 cases in, let me restate that, I think I said that wrong. We've had 677 cases over the last 2 weeks in Jefferson County, of which 56 of those cases were from Westminster. The reason I say that is because one of the big things we are dealing with, as is Tri-County Health Department right now, is the fact that we have received a variance from the State Health Department that has allowed us to expand some of, particularly the numbers that are allowed in gatherings and in gymnasiums and pools and various places. And that was granted when we had a rate of 55 cases per 100,000 in Jefferson County. When they gave us that variance, they said that if we got up above 100 cases per 100,000 in our county, we would be in jeopardy of losing our variance unless we could bring that down over a 2-week period down below the threshold. So we have been watching closely as we have been sneaking up to that 580 limit that was the threshold for Jefferson County. Unfortunately, on Friday, July 24th, we passed that. And since that time, we have been up, like I just said, 677 instead of 580. And we are, for the last week, holding fairly steady there. We're hoping that it begins to come down, but it does not look like we're going to be able to get down before Friday, this next Friday, below that 580 threshold, which will mean that the state can rescind our variance. That will particularly hurt some of our smaller businesses that have been able to expand some of the numbers that they can have in their businesses. And like I said, gymnasiums, swimming pools, and some of the other areas where we have been granted that variance. Interestingly, El Paso County also just passed, was in jeopardy of losing their variance. And the state evidently has not taken their variance away. So we're looking into that to see if maybe we'll be able to keep our variance, but we are at an area right now that is really an area where we do not want to be. That's probably the biggest area that has changed since the last time I met with you. A couple other things that there may be some questions regarding would be the mandatory mask order that was put out by the governor. I know Westminster has had a mandatory mask order in place already, so you may not have too many questions about that. Also, Jefferson County Public Health has put a public health order in place requesting large events must submit a plan for their what they are planning for their large events 2 weeks before the event, so that we can review the plan, work with them to make sure that they have in their plan all of the things that would be necessary to make sure that they are in compliance with the public health order that is in place. The current public health order, which actually changed over the weekend, we are now in the 9th amendment of the State Public Health Order 2028. There are not a whole lot of changes between the 9th and the 8th amended orders, so I don't think it's worth spending a lot of time on that. But we are doing our best, because we are living under the state's Public Health Order 2028 to make sure that all of our venues in Jefferson County are in compliance so that we can hopefully get back under that threshold so that we are not in jeopardy of losing our variance and we can continue with the numbers that we have had. That's pretty much what's been going on most recently. I would be happy to answer any questions that any of you may have or address some areas that I may not have touched on. If there are some areas or concerns or questions that any of the council members have.
Dr. Johnson, I've got a couple of people who are going to be in a queue for asking questions. Before I turn to Mr. Seymour first, have you had any indication at all that you, Jefferson County Public Health, may be directing Jefferson County schools to stay remote through the first quarter?
We do not direct the R1 school district as to what they can do. We have been advising them. We've been working with them. We've been looking at the issues that they are facing. But at this point, we have been working closely with them. We agree with the plans that they have in place that currently are there. Although I will highlight the fact that on the very front page of their plan currently, it says that all of these plans may change based on what's going on in the community. And at this time, not just what's going on in the community, but also data, any scientific data that we get. There have been a lot of articles coming out recently around the country in medical journals that are to some degree contradictory, but some of them showing that there is very little transmission among school-aged kids, particularly those under the age 10. More recently, there have been some studies that are showing that some of these kids actually do harbor more of the virus than we thought in the past, and may actually be able to transmit that more than we thought. So we're trying, along with the R1 school district, their director of health services, and Dr. Glass. We're studying closely what's going on. We're looking at some of the outbreaks that have been showing up around the country and around the world, trying to make sure that whatever plan is put in place is as safe as possible. But as far as the question you asked, we don't direct them what to do. We are just advising them and working with them.
So for the sake of discussion, right now, the plan they have is the plan that you've approved based on what you know today.
Right now, the plan that they have in place is one that we have advised them on. We have not officially approved anything, but I am in favor of the plan that they currently have. And as I said, we're studying it every day to see if there's any changes that need to be made.
All right, thanks, Dr. Johnson. Mr. Seymour, if you would, please.
Thank you, Mr. Mayor. Thank you, Dr. Johnson, for being here once again. Just a couple of questions and then some comments to have on the record. Part of the reason that we're here discussing this today was some data that I brought up last week that was statewide. So I'm glad that, and I do have all the Jefferson County data in front of me also, so I appreciate that. But when you were visited with us first, and I know that every day is a new learning day for this COVID epidemic. But at that time, you mentioned along the lines that public health officials felt that the infectious rate, and at that time, I believe you mentioned could be at a million people in Colorado. But I've also now heard data that based on our slow testing that the positives, total positives, could be at least 6 times-ish of the data that we've seen. Do you have a better understanding of that, or have you and your colleagues discussed that?
Thank you, Mr. Seymour. We do discuss that. We look at that often. We don't have good data on that. Again, we now do have more testing available, but like I said, quite often the testing is so late getting back that it's almost useless as far as any planning. But the data that you're talking about has been looked at by the Centers for Disease Control and Prevention, and they have estimated that it may be anywhere between 5 and 20 times as many positives as what but are actually showing up in data across the country. So we do believe that there are a lot more people who are positive who have not been tested, because between 20 and 40% of the people who do get this infection have either very mild symptoms, or they just think they have a cold, or they don't have any symptoms at all. The problem with those are they still can pass the disease, but they usually are younger, and they do not seem to have symptoms. Interestingly, there is more and more studies, however, showing that even though they don't have symptoms, the virus actually can cause damage particularly to their lungs and to some of the other organs, even though they don't know they're sick, they don't feel sick. So as you mentioned, we're learning more about this virus every day, and we're learning more about how widely it is spread. But those are the numbers that the CDC thinks, that we may have even up to more than 20 times the number of cases out there than what we have recorded.
Thank you. I appreciate that. And I'm also looking too at the graph here on the Jeffco Public Health site, and I appreciate your people publishing these. One thing that I cannot correlate by looking at it is, as we've had increased positivity, especially the first weeks of July, did we see an increase in the hospitalization rate?
We had a large increase in the hospitalization rate in May. We then I don't have the graph in front of me right now, Mr. Seymour, but as this positivity rate dropped off, the number of hospitalizations also dropped off. It has been very low over the last month or so. It's been fairly low. Over the last couple of weeks, it has picked up a bit, but nowhere near the number of hospitalizations that we were seeing back in April and May.
Thank you. And then also too, I'm surprised to find, I looked at the demographic breakdown, and not necessarily in relationship to Jefferson County schools, but in Jefferson County, not a single person has died that's under 20 years old, but 92% of our deaths are from age 60 through 80. And then it's also interesting and surprising, considering how exposed they are, and then some underlying conditions, that we only have 3 known homeless people that have passed, unfortunately, in Jefferson County. So I was surprised by that number itself. So I know we've had outreach to some of the homeless encampments to test those people, and in some cases remove them to hotels, but I'm surprised at that rate, considering it is a population that is exposed. Those are mostly comments on my part, and I was also too, we know who is getting infected and dying from it, as 70% of the people that have passed away were in some institution or another. So we know where those rates are coming from. But I appreciate your time very much tonight, Dr. Johnson. Thank you.
Thank you, Mr. Seymour.
Mr. DeMott.
Thank you. Kind of follow up on some of what Councilor Seymour was sharing, and it looked like a big number of those deaths, like 50+%, were, I believe, over 70 years of age. Looking at the numbers that are posted on the state website, or 52% or 80+ years old is what the number I was thinking. So interesting. And I mean, obviously we don't want to see any loss of life if possible, but I think that kind of information is important for people to understand. One of the things I was hoping to be able to do, which I haven't been, and this kind of gets to my question earlier on about being able to see trends in Westminster, because what I'm curious about, Dr. Johnson, is in the places like Westminster that have put a mask mandate in place, if we've seen any correlation with that. I know that I had seen an article the mask mandate went into place in California, and weeks later, it looked like their numbers had actually increased. I'm just curious your thoughts on that, and if we have any data in Colorado or specifically any of the cities in Jefferson County that show how the mask mandates have correlated with infection rate.
Thank you, Mr. Dumont. I do not have any trend data from the areas in Jefferson County that have had mask mandates before the state mandate went into place. That would be Wheat Ridge, Westminster, and Golden. I have looked now, it's been actually since July 16, I believe, since we have had the statewide mask mandate in place. And we do not yet have any clear trends as to what's going on, although, as was mentioned by Mr. Kirschbaum and the data, it does appear that we are beginning to level off a bit.
Well, and maybe this is a follow-up for our team as well. Once we try to look at some trending for Westminster, even if it isn't perfect, really what I would like to try to get at is, if I look at my numbers right, it looks like we did our mask mandate beginning of May. I think we voted on it May 4th, if my notes are correctly looked at, and that's basically 6 quarantine cycles if you're looking at a 14-week quarantine cycle. So I think that would be a good point of data for us to understand, and if it correlates that helped, it would be important for people to know that so that they understand why that's a positive thing for them to participate in. Even though it's mandated, I heard this morning the mayor mention on a webcast that when you guys did your last check, we were trending of like 90% participation rate in the city, which is great. But that's part of what I'm curious about. The other thing I really would like to ask you about, Dr. Johnson, that was brought up last week when they decided to ask you to come in, and again, thanks for joining us. I had brought up last week about some of the trends looking like potentially how potent, I guess, this virus, or how dangerous it is, that potentially the data is showing that it's starting to not be as damaging to human beings as it cycles through, just from looking at the hospitalization rates. And I know that's one of the things, with viruses as they cycle through mankind, that we hope for, that, we become more resistant to it. Do we have anything in the data that has shown you that, or have you and your colleagues had any conversation around that that's worth noting?
Thank you, Mr. Dumont. A couple of things that I would just mention in response to your comments and questions. One of the things that has been shown is that actually mask wearing does, even if you do get infected, tend to decrease the viral load that you get with your infection and decreases the severity of the infection. There's more and more data that's beginning to show things like that, which is interesting, that even though there may continue to be positives, they're not as sick. And we are clearly seeing that there is a drop in the, as you mentioned, the potency or the severity of the disease. It also now is hitting a younger population, 20 to 40-year-olds who usually have a better immune response to that. And so we're not seeing as many serious infections, as many hospitalizations, or as many deaths as we were before. Also, I would just say that the long-term care facilities have really done an excellent job of improving the care that they are giving, and their ability to limit folks who are coming in and out who may be bringing infection in. So they should get some credit for the change there. As far as the change in the virus, there is a lot of work that is being done on the genome and watching to see if it is changing, how it may be changing. Are there mutations that are taking place? There are, at least the last I saw, at least 8 different mutations that are showing up around the world. There was some interesting evidence that perhaps the one that hit New York City was a more virulent mutation than the one that hit in California and Washington. At least that was some speculation at first. So there are some changes, as you mentioned. Absolutely, as a virus passes through a population, it does tend to change. For the most, it does tend to get less virulent, although occasionally it gets more virulent, but we are seeing some of those trends taking place. And yes, a lot of talk is being done, a lot of study is being done, and that is showing up in some of the research that research literature that is being printed.
Great. That is all my questions. Again, thank you for your time tonight and for you joining us again and all your work that you've done during this this 2020 period with the COVID-19.
Thank you very much, Mr. Mott.
Ms. Seitz.
Thank you, Mr. Mayor, and thank you, Dr. Johnson, for coming back and helping us understand this. I think we as council members feel an enormous amount of responsibility to want to be able to communicate without scaring our residents, really about the seriousness of the pandemic and what they can do to best protect themselves and to protect our local economy. So it's really critical to have you here. And I was actually the one who requested to have you come in again because I feel we were all of us playing a little bit armchair epidemiologists. And so last week there was some discussion about the mortality rate and the hospitalization rate. And what I found interesting is some of my colleagues were using the entire population of Colorado as the denominator. So saying, you know, there's only been, you know, at the time, I can't remember what it is, but I checked this morning and there was 6,479 folks that had been hospitalized. Well, that seems like not so bad of a rate if you divide it by the whole population of Colorado. But my question to you, isn't it more appropriate to divide it by the number of known cases? Isn't that more typically how you would determine, you know, the hospitalization rate? Recognizing we don't have a perfect denominator and there might be more people who are positive, but at least of those who are symptomatic, the hospitalization rate would be not done by this, or the death rate by the population of the whole state. Is that correct?
Thank you, Ms. Seitz. You raised some excellent questions, and there has been a lot of talk about various different kinds of rates and about how low they are if somebody wants them to be low, or how high they are if somebody wants them to be high, and people are choosing sort of different rates depending on their purposes. The two that I see the most, one is the crude death rate, and that is how many people are dying from this compared to the whole population in the state. That's sort of a crude death rate. Out of all of your population, how many are dying from this? And that number has been around 0.4 as to what the crude death rate is. Another one that is also looked at quite frequently, which actually is a ratio more than a rate, and that is the case mortality rate, meaning of everybody who has been tested positive for this disease, how many of them are dying. So you basically compare all of those who died of it to those who have tested positive, and it gives you what's called the case fatality ratio. That's more likely the number that we use when we're looking at a specific infection to see how virulent it is. That has been running around 6% in Jefferson County. It's gotten as low as 5.4 or so, and it's gotten as high as 8 point something, but it's running around 6%. That, of course, is tremendously impacted on how many tests you're doing. It's also impacted on the age of your population, and Jefferson County does have an older population than most of the counties in Colorado. So that's another number that we look at. The hospitalization rate is another one that you raise, and that is of everybody who tests positive, how many of them are hospitalized. That has been running in the usually right around 20% when we look overall, not just in Colorado, but overall in the country. About 20% are hospitalized, and about 20% of those end up in an ICU. And then the death rate of those is fairly high. As we mentioned earlier, though, as the shift in the population for a number of reasons, both the improved care of those, particularly who are in congregate care areas like long-term care facilities, has improved. We're getting a younger population that is testing positive, and the hospitalization rate for them is not as high. So the hospitalization rate is going down a bit. They also tend not to be quite as serious, so we're seeing a decrease in the ICU rates also. I'm sure you've all seen the book, How to Lie with Statistics, and depending on what you're trying to do or what you're trying to prove, you can take numbers from all over and kind of make your case. We try to take all of them and look at them and see what the trends are and what they're really telling us. And those do change some, but they've been fairly steady over the course of this. I hope that's helpful, Ms. Seitz.
It's incredibly helpful, and I think that's why we rely so heavily on you. Is because cognitive bias is real, and people will look at data to kind of prove their own assertions. So it's nice to have someone who understands public health. What are the generally accepted principles for communicating data and interpreting what they mean, and the severity of any given disease, and then make recommendations. So thank you for kind of going through that. And, I do want to highlight, that this is a novel virus, and so we're learning as we go. But can you please correct me if I'm wrong? It's a little bit too early to make huge sweeping assumptions, that this is maybe less dangerous than we thought, or more so, but that we just really have to be cautious and measure and monitor as we go. Is that correct?
That is absolutely correct, Ms. Seitz. As I mentioned earlier, we're learning new things about this virus every day. One thing that I would add goes back to sort of your rates, and that is, it is now the third leading cause of death in Colorado, and probably will be for this year, only second to heart disease and cancer. So all of the other causes of death will pale in size to what we're seeing with this. So it is a very serious, even though people like to sort of parse out which age groups or the areas where there are hot spots and deaths are occurring from a statewide point of view, and it will probably turn out to be nationwide too. This appears that it's going to be the third leading cause of death this year in the United States.
You brought up earlier the kind of chronic health conditions, or the problems that can occur from people who have been infected and were silent carriers of the disease, that it actually COVID can have some health impacts on them. Something you haven't mentioned, but I've been following loosely as a mother of 3 kids, is this new inflammatory condition that children have after being exposed to COVID. Do you mind explaining that to us? Because to me, that is a little bit, that's relevant, and it's fearful because it's a new impact on a population that we thought, the blessing of COVID was that it seemed to go easy on kids.
Yes, thank you, Ms. Seitz. There is a condition, a syndrome that is associated with this in younger children, where there is a strong inflammatory response with a rash and a fever and organ damage that's very similar to something, or appears to be similar to something called Kawasaki's syndrome, or Kawasaki disease, which has been around for quite a while. Thankfully, it is extremely rare. There have been numbers of cases in the United States, but it is very rare in children. And there have been a couple deaths, but again, very rare. So it is something that we worry about. It's something that everybody in practice is watching for, to make sure that they catch it quickly and can treat it quickly. But it is one of those things that we are learning about with this novel virus, that it does strike fear in any parent's heart, because if there's anything good about this infection so far, it has spared our children to a large degree. And this is one of those things that does seem to hit them. I don't know and I don't know a whole lot more about that than it is. It does happen. It is fairly rare, and it's something that we're watching for and are concerned about.
Well, thank you. I'm heartened to hear that it's fairly rare, or very rare rather. I only have a few more questions, and I apologize for taking so much of your time. I wanted to ask you real quick. We have seen a spike in the 20-somethings, I believe the 20 to 29-year-olds with positivity of transmission of COVID. And we've talked tonight just about how that has led to less hospitalizations, lower mortality rates for that population. But do we think that that might indicate another wave of infections for older adults because people don't typically live in isolation, and if it's more frequent with that age group, they may be more likely to be silent carriers, bringing it to their parents or grandparents or into the grocery store? Are we concerned that that might, while we won't see it today, it might present in 14 days from now, whatever, a spike in other populations? Or am I being a little paranoid about the number?
Thank you, Ms. Seitz. I don't know that I would say it's possible to be too paranoid about this, because like you mentioned, this is something brand new. None of us really know what's going to happen with it. There are some signs that maybe it's things are getting better. There are also some signs that things may be causing more problems, particularly long-term problems in the younger population. What we are seeing right now is we are seeing a spike in the 20 to 40 year range, I would say. And we're finding that for the most part, those are related to travel and to basically parties. That small gatherings, barbecues, small backyard gatherings like that, and kids going to parties is where we are able to track this more so than to large events or other places. And we are concerned because this is also one of the concerns with kids in school, is that it's the kids do not tend to get it or have a serious disease, but they are exposed to bus drivers and staff and teachers and others. And quite often they're coming home to multi-generational homes, and the parents and the grandparents at home are also very susceptible to this. And as I mentioned, there was a new article just this week in the Journal of American Medical Association that shows that children, even young children, have very high rates of the virus in their mucus, in their nose and in their mouth, and may be spreading it more than what we have been able to prove in the past. So I think all of us are a bit paranoid as to what does all this mean.
So I appreciate your time and your patience with all my questions. If you had suggestions, so I know as a public health official, you're probably also concerned about the social emotional costs of isolation, or the real public health impacts of poverty, right? If people aren't able to earn a living. What best advice do you have for us and for our residents to help us combat COVID so that we can have some semblance of normalcy, or at least get back to normalcy more quickly? Do you believe in the efficacy of masks now? Do you feel like the data, I know before there was some concerns, you're feeling much more confident in the efficacy of masks? It sounds like, talking about that viral load. What other things, other than wearing our masks, what would you recommend to us? I'll be honest, I have had friends in my backyard, and I've tried to, practice social distancing in separate areas where people are. But is it too early to do things like that?
Yes, I do think it is too early to do things like that. And, I have been to weddings and to other places where there have been small groups and gatherings. And it is interesting watching as the evening progresses for the most part, people get more and more comfortable, and the masks come off, the distance decreases, and it's a lot of what we are advising from public health experience tends to go by the way. But the best advice, I think, is really what we have been saying all along, and you can really narrow it down to about 3 things, and they are all sort of related. The data continues to show that the major way this disease is spread is through what we call droplets or aerosols or spit or whatever you want, mucus, whatever you want to call it, going from somebody who's infected to somebody who either breathes it in or touches it on a surface or gets it into their eyes or nose or mouth, and that's how it spreads. So the greatest things we can do are to physically distance. That's one that has been there since the beginning, and it continues to be extremely important. That most of the droplets that have the highest viral loads drop out of the air within about 2 meters or a little bit over 6 feet. And if you can maintain that 6-foot distance, that's one of the best things you can do. If you can't maintain that distance, or if you want to improve really it helps to improve the distancing, is you wear a mask. And if both of you wear a mask, it both stops the droplets coming out of somebody who's infected, and it stops you from breathing in or getting into your nose or mouth some of the droplets that are there. So those are 2 of the major things that we have been saying since the beginning. And it's not that I just happen to agree with this. I know there were many back in early May that said we should have a mandatory mask order for the county or the state at that time, and as Westminster did, some moved ahead with that. At that time, I was not convinced by some of the studies that had been done. At that time, most of them had been done on influenza, and we continued to strongly encourage mask use, but we did not feel that it was necessary to make it mandatory. Since that time, more and more studies have shown that they are very efficacious, that they do help to stop the spread, and so we have adopted a mandatory mask order here at the county as well as with the state, and expanded it beyond just indoors but also outdoors when you can't be sure you're going to maintain that 6-foot distance. The third thing is, again, something we've been talking about all the time, and that is cleanliness. And cleanliness, basically what that does is it makes sure that if somebody has coughed or sneezed or spit and gotten something on a surface that you are touching, that you clean that surface or you clean your hands and decrease the amount of spread that way. So really those 3 things, social distancing, wearing a mask, and keeping both the area around yourself and in your community clean, all of those are the best things you can do to try to decrease the spread of this disease. And they're fairly simple. They're not expensive. It unfortunately has become a political thing around mask wearing, whereas we in public health are trying to be as apolitical as possible and just say this is what the data shows, that this does help to decrease the spread. So those are the 3 things I would encourage. As far as poverty is sort of it hits on many levels. Folks who are in poverty tend to live in more crowded spaces. They tend to live in multi-generational spaces. They tend to have jobs that are on the front line of the workforce, and they quite often need to take public transportation to get to work. And so all of those things increase the risk of them getting infected and have a tremendous impact on this disease and the spread of this disease.
Well, thank you so much for your answers, and thank you for keeping this apolitical, data-driven, and using the best science and your professional opinion to help guide us. I truly appreciate it, and good luck in the days to come.
Thank you very much, and thank you for the invitation to be here.
All right, Mr. Demott, Mr. Seymour, I will come back to you once I've gone through the whole council at one time. Ms. Scully, I'm going to come to you, and then Ms. Smith.
Thank you, Mr. Mayor. And thank you, Dr. Johnson, for being with us tonight. I really appreciate all the information you've shared. Certainly have clarified some things for me, and I appreciate that. This weekend, I had a very intense conversation with someone who was concerned with the length of time that they were wearing the mask, and that the mask might be causing them to be sick because they're breathing back in their own air. And they're worried that that's causing them more illness than if they just didn't wear the mask. And this is a frontline worker, somebody who is working 4 to 8 hours in a local big box store and waiting on or serving our community. So I was wondering what your opinion was of that, if that is really a concern, or have we seen any indication that that is a problem? I was just curious if you had any thoughts on that.
Thank you, Ms. Scully. I do have some thoughts on that. There has been a lot written about that. There's been a lot on social media about that, and there's been a lot of even on some of the media about that, but the data does not support it. Unless you are wearing what is called an N95 mask, which is a very tight-fitting mask that has to be fit professionally to your face, you are getting a lot of air around the corners and around the mask, so that the chances of you having a high level of CO2 or passing out because of the level of CO2 that you may have is very, very rare. In fact, I have never heard of that happening. The other thing is that the use of a mask over and over again is not encouraged, although in some hospitals they are basically, at least particularly early on, they had 1 mask per week for people who were wearing the mask. And I have heard of nobody who got an infection from wearing the mask through the whole week. Cloth masks, if you are wearing a cloth mask, we are encouraging it to be washed every day so that you don't collect the spit and other things, or the moisture that you have from your breath on those. Keeping that as clean as possible is good. Also, there have been a lot of people who talk about how OSHA says that you can't have an oxygen level below 16.5% in the air, or you're breaking OSHA's guidelines. That is extremely rare and happens for the most part only in certain manufacturing areas. The percent of oxygen in the air almost always is 21%, whether you're at the top of Mount Evans or at sea level. And to get it down low enough to have called hypoxia, you pretty much have to have some other gas around that is moving the oxygen or overtaking the oxygen. And that almost only happens in certain manufacturing areas. So for the most part, I think all of the hype around the masks is much more about people disliking them, or either, and they are a pain sometimes to wear. But as far as being dangerous or causing infections or having people pass out, surgeons wear them for 12 hours a day, sometimes for long surgeries, and don't change them. It is extremely rare. In fact, I have never heard of anybody passing out because they wore a surgical mask or a cloth face covering. Theoretically, if you had one of those very tight-fitting ones, it could be possible, and those should be changed more frequently during the day.
Thank you so much for that answer. That made a lot of sense to me. Another question that I have is, we've heard a lot about covering our eyes now, wearing facial shields, or I would assume glasses would serve the purpose. But can you talk to that a little bit? Should we be encouraging people to also be wearing a clear facial shield so that they protect their eyes from droplets as well?
Thank you again, Ms. Scully. The way this virus travels, or the way it gets into a human body, is through what's called a mucous membrane. And the mucous membranes that are most exposed in human bodies are in the mouth, in the nose, and around the eyes. And so the more you can keep those covered, the less chance there is that you'll get a virus into that area. For the most part, however, it is the face shield is sort of an addition. If you're wearing glasses, or unless you're around something where there is a lot of aerosol being caused, like in a dental office, or if somebody is putting a tube, a tube into a tracheal tube into somebody, and there's a lot of coughing and sneezing, and that where there's a lot of droplets and a lot of aerosols in the air. For the most part, most people are not getting a lot of exposure to their eyes, but it certainly adds a level of protection. I wouldn't discourage it, but both the level of getting those droplets in your eye and the viral load of the aerosols that you're getting there are probably low enough. And so in hospitals, most people will wear those if they are doing, like I said, they're doing a procedure where there's a lot of aerosol being manufactured because of the procedure that they're doing. They will wear that. You will never see, well, I should never say never, you will almost never see anybody in healthcare that is only wearing a face shield. The face shield always goes with a mask and sometimes with a double mask to help to decrease it. But they certainly do help to keep the eyes from getting anything that may be in the air.
And what about wearing gloves? Are there certain gloves that people, I know I've seen a few people starting to wear gloves. Is that helpful? Are there certain types of gloves people should be considering? Are we looking at maybe just being cautious? I turned around to someone the other day and said our new accessories are going to be masks and white gloves, as they did in the 60s with the white gloves and 50s. Is that something we should be considering? Is that a healthy way to try to combat this? I'm just curious.
Again, it goes back to what I said earlier about cleanliness, and that is if you are in an area where there is a lot of spread of droplets onto common surfaces, where you have a lot of people coughing or sneezing, or somebody who is coughing and sneezing a lot, and it's being put onto surfaces that you may touch, your wearing a mask will theoretically decrease your chances of getting that. Although if you are wearing a mask, wearing a glove, and you touch an area that has been exposed, and then you touch your mouth or your nose or your eyes, it's no different than if you had used your hand. So there's nothing magical about a mask, about gloves. It's just that they do help to keep your hands clean. They should be changed frequently. You should still wash your hands after you take them off. And in the governor's order, the public health order, there are certain requirements for certain businesses that they provide gloves for people who are exposed, who are using their hands a lot around areas where people may be coughing or sneezing and they may or may not know it. The fear that I have is that people who wear gloves tend to think that they are magical and that they don't have to be as cleanly, or they don't have to change them as often. And if that's the way you're treating them, they're dangerous. So you should use them only when you're around an area where there may be a lot of exposure. You should get rid of them, wash your hands, and then put on a new pair if you're having to do something again in that area.
Do we happen to know, I know someone's already asked about the hospitals and the patients and the number of patients that are in the hospitals and the beds, but what about the PPE? Do we have enough PPE? We're about to hit our fall onset of the first round of even other illnesses like the cold, the common cold, and then of course that builds into the flu and pneumonia, and so there is a concern that if we are now going to be combating that with all these additional illnesses, do we have enough PPE at this point? Do we feel good going into the fall? Have we built up our resources?
There's a couple levels of answer to that. Most of the hospitals have been very, very diligent in gathering PPE for their staff. And right now, the 2-week prediction as to whether they have enough PPE for a 2-week period is pretty universal, that all of the hospitals feel that they do. They also, just anecdotally, I am hearing that a number of them are stockpiling as much as they can PPE for the fall, because we learned rather quickly that we could not rely on the national stockpile of PPE with the first part of this wave. And so a lot of the hospital systems particularly are feeling that they're on their own and they better get as much as they can. So yes, they are stockpiling, they are gathering as much as they can, and currently there is enough. Interestingly, and I would just add that one of the things that is being seen around the world is that with mandatory mask orders in place, it has decreased both colds and flus and pneumonias from other causes. And so there is some anticipation that, we were very concerned about the flu hitting at the same time as another wave of COVID-19 hitting in the fall. If everybody is really living up to the mandatory mask orders, we may actually see a decrease in our flu rates this year, although I would still strongly advise everybody to get a flu shot.
And that's so funny because that was my next question is, what was our prediction for cold and flu season, but you answered it. So thank you so much. I really appreciate you taking the time to be with us tonight and helping us sort through our questions. I think that sometimes we get our questions all sorted out and then a couple weeks later there's enough influx of information that comes from the news and the social media that we need a revisit to see how things have truly changed. So I appreciate you sharing with us tonight. Thank you very much.
Thank you, Ms. Gilly.
Ms. Smith and then Mr. Demott.
Thank you, Mr. Mayor. And thank you, Dr. Johnson, for being on here and going through lengthy information about COVID and where we're at. It's very helpful to understand just kind of a snapshot from when we first talked to you up till now. So I appreciate that. One of the thoughts that we had, I believe it was last week, and one of the reasons why we wanted you to come back to council and give this update was to provide us some information as far as meeting in person. And it just seems from listening to all of your information up to this point, if we're wearing masks and we have proper social distancing and shields in place, all the proper PPE, that we in fact could meet as a body to conduct governing items. Is that correct?
The way you added everything in, yes, if you did everything perfectly and everybody was well masked and well separated. And the other thing that I would add, however, is that it also would be good to be in a place where you had high ceilings and you had good ventilation and you were not together very long. So I have often said that the real things we need to look at are the place where we are meeting, the spaces where we are meeting, the pace or how long we are meeting, the face mask, how long we're wearing, do we have face coverings? And all of those are very important. So the quicker you can have a meeting, the less time you're spending together, the better it is. The less time you're in the same space, the better it is. You would be better to have meetings outdoors than indoors, but if you're indoors, if you have a huge, a very high ceiling and a great ventilation system and you're distanced from each other, that all of those decrease your risk, yes.
Okay, and did I misunderstand? You mentioned the amount of time we're wearing masks. Can you speak more into that? Because I know that Catherine Councilor Skiller just asked about the wearing of masks, but you just mentioned the duration of masks.
I did not mean, I'm sorry, Ms. Smith, I did not mean to imply that I was talking about the masks. I'm talking about the time that you are together in a meeting.
Okay,
Thank
got
you.
it. Thank you so much. I appreciate your time.
Surely, thank you, Ms. Smith.
Mr. Demott. And then Mr. Seymour.
I have one quick question and then I have some comments about some of the stuff we just heard. Question for you, Doctor, is one of the things that we always heard were we were trying to flatten the curve. And I know that we got us, we kind of went down, came back up. But was that not always going to be the case? I mean, my understanding was we always expected once you open back up, but there's a reasonable threshold of what the state wanted, which is what we're trying to avoid. But I'm just trying to understand, what's the goal? Like at the end of the day, COVID's not going anywhere. At some point, people need to be able to live at a reasonable level and avoid risks, just like we do every day. So I'm trying to, two things. One, am I wrong in thinking that we always knew that there was going to be more cases once we get back to being out? And two, what do you see the end game as far as, being able to be back out in society? Like, at what point do we as a society say, this is now a reasonable risk that's always going to be around and we can go back to our lives?
Thank you, Mr. Dumont. We in public health are not very good marketers. And when we first started talking about what we were hoping we could do at the very beginning, we actually mentioned 4 things. And this was all the way from the White House and their task force down to the local public health. We said there are 4 things that are very important that we need to see before we begin to open up, reopen after our stay-at-home orders. One of those was, are we seeing a decreased number of hospitalizations? That was that flattening the curve. One of them is, were we seeing a decreased number of deaths? One of them was, were we seeing a decreased number of cases? And that was particularly, we were saying we needed to see a 14-day decrease in the number of cases before we felt like it would be safe to open up the economy again. We all got impatient, and we basically did see a decrease in deaths. We did see a decrease in hospitalizations. We did see an improving of the ability of, the one I didn't mention was the ability to test. We did see an increase in the ability to test. We have never yet in Jefferson County, to my knowledge, and I should never say never, but we have not yet seen 14 straight days of decreasing number of cases. And everybody focused on the flattening the curve. And once we saw a flattened curve, everybody said, okay, we can go back to normal. But we did not ever see that continuous decrease in the number of cases. It has continued to go up and down. And so instead of focusing so much on flattening the curve like we did at the beginning, we should have focused on all 4 of those things. And I think that's why you're seeing that particularly some places opened up way too quick, because people got quarantine fatigue, and it was hitting the economy very bad. And so trying to balance, again, the poverty and economy and all of that, I think the political ones who made decisions as to when we were going to reopen felt that we had to open up. As you probably remember, we in the Denver Metro Region Public Health Director said, we're not ready to open up, and we kept it stay-at-home order for another 2 weeks. We still, however, never met that 14-day straight decrease. So yes, we have seen a flattening of the curve, and the end game, which is really what you were asking for, the end game is that we are trying not to overwhelm the system and trying to keep deaths and infections as low as possible until we either have a really good therapy, medical therapy, or we get to a point where we have a really good vaccine. Once we get to that, we can either then treat people if they get sick, and we're getting better at that. We have found some things that help. Or we get to the point where we can actually cause herd immunity by giving vaccines. Then we can begin to open up and feel more at home and be more normal. Because what we're trying to do now is keep things steady as low as possible, or at least not overwhelm the system, until we get to the point where we can either treat people or vaccinate people. The alternative to that was some countries have just said, we want to get to herd immunity. Let's just let everybody get sick, and we'll see what happens, and then we'll get herd immunity. That's kind of what Sweden did, and they have actually come back and said they made a mistake because they are 7 times more death rate than those countries around them and things like that. And the modeling showed that if that's what we did in the United States, we would have up to 2.2 million deaths. So we said, that's not what we want to do. Let's try to control things until we can get to a vaccine or a treatment.
I appreciate that explanation. I think one of the things that is frustrating is the politics of it all. And I would argue that wanting to get back our economy into life isn't truly all political. people are hurting in jobs. And I've heard before people say that the cure can't be worse than the virus. And that's really the balancing act. I think a lot of leaders from the national level down to city councils and school boards are really weighing. So I reject the assertion that it's all political. There definitely has been way too much politics involved in this process, where we're not really just looking out for the best interests of everybody sometimes. But a couple things that I just wanted to hit on. Mayor Pro Tem Seitz had talked about some of the what she calls, armchair quarterbacking last week. I brought up some of those numbers to be straightforward, and I think that one of the things I was trying to get at is if you look at infection versus population or death versus population, the risk seems different. And yes, you can take these numbers and make it sound as scary as you want, or give some hope. I would rather give some hope to people and realize that, yeah, this is dangerous, especially for specific people. So when we talk about age and we talk about hospitalization rates, it's important for people to measure risk. Life is full of measured risks, and there's nothing political about that. That's just the reality of living on as a human being on the planet Earth. So, I think that that's unfortunate. And one of the things that I would say has been so frustrating for the public and myself in general is how we have learned. And then for some reason, as people become more skeptical, that somehow that's wrong. We heard from Dr. Fauci himself at the top level, at one point, don't wear masks. And we heard do wear masks. And some of that's been proven out, like you've shared here tonight about the value or not value of these different things or medicines as we went through this. So I think that the public does get frustrated when they hear different things. Just tonight, I heard one person say they had a backyard party and somebody else say they went to a wedding at the same time, saying that it's too soon to do those things. So I think that people's frustration is understandable, and trying to understand the full picture of the data is important. So the reason I say all those things is because I think it's important when people who have differing opinions about the way they look at data understand where people are coming from, and that it's out of a place of trying to understand and explain it to people who look at things different. That's why we have 7 council members with very different minds. We all look at things very different. So it's important for each of us to have our questions answered and be able to look at these things. So I appreciate, again, all the information that you've brought here tonight and all the work that you've done on this and you will continue to do on this matter. I think it's very important, but I also think it's important that people understand where each member of this body comes from when they ask questions.
Thank you, Mr. DeMott. If I could just make a comment. If I stated or if I implied that it's all political, I did not mean to say that. I think it has at times gotten too political, but it is not all political. The other thing that I would just mention is science is very frustrating. Science can be very ambiguous, and science is very frustrating to many people in the fact that one week we learn something new and we go back and say, everything we told you last week is wrong. We now have better data, we now have better studies, we now have better research that shows that this is what we need to do. And so that can be extremely frustrating, and I do understand that. The other thing that you mentioned about the mask and Dr. Fauci, you also have to take into consideration the context. When we first started this, we were running short of masks, and we were trying to save all of the surgical masks for the frontline healthcare workers. And as I mentioned earlier, the data at that time, which had all been done on influenza, was not overwhelmingly in favor of saying that this was really going to help. Since that time, we now have a much better supply of masks. We now have much more data that shows it. And so that's kind of that frustration of science and the context. At that time, they were trying to save masks for the frontline workers and for the hospitals. And so they were saying, don't wear a mask, save those for the front line. And now we have both more masks and both more data that say, now we should be wearing masks. So science is frustrating. I share that frustration with you. The context can also make a difference. And it was not all political. I'm afraid it's been too political. I think it's probably the most partisan pandemic we've ever seen in the history of the world. But every pandemic does have some politics, and we try to keep it out as much as possible. So thank you, Mr. DeMott.
No, thank you. I think that's a good summary of it, and I agree. And I think you pointed out why some of these questions are important so people understand how we got from point A to point B and how this has progressed. So I appreciate the summary and the follow-up statement.
Thank you.
All right, Mr. Seymour, we've had quite a bit of time with Dr. Johnson tonight, so would you please wrap this up with your comments?
Thank you, Mr. Mayor. Again, we've thanked him enough, so I appreciate that. But I am very glad that we invited him on because he validated the fact that the accrued rate of total population is one of the factors that's being used. It is many of them, and also the factor that I also presented using the minimum amount of projected positive tests and a hospitalization rate of 2.3% and a death rate of 0.63%. So these are all numbers and these are facts, and it sounds like that there's different factors that can come into play, and we each have to look at those, and I give Councilor DeMott credit for discussing the amount of risk that we could have or willing to take. So thank you very much and we appreciate it again.
Thank you.
Dr. Johnson, thank you very much for your time. I know that your time is in great demand, not only in your day job, but meeting with all these elected groups throughout the county. So again, thank you for your time and we appreciate it, and hope you have some rest tonight.
Thank you very much, Mayor. I appreciate it. Thanks to all of you.
Mr. Tripp, do you have anyone else has any updates on the COVID materials?
Yes, yes, we do, Mayor. Dr. Johnson, thank you for your incredible commitment and the time you spend and your patience with all the questions and all the inquiries you must be getting many hours a day. So I very much appreciate you, and also your staff, the work that they've done with our staff and trying to make decisions about what to do and not to do. I'd like to turn to Larry Dorr, and I'll just back away and let Larry and John Hall really take the rest of the COVID report. Larry has some financial information he wants to provide, and part of it is in some material that was sent to you earlier, Council, and then John Hall will finish up with the recovery plan update. Thank you.
Thank you, Mr. Tripp. This is Larry Dorr, Chief Financial Officer and Deputy City Manager speaking. Mayor and Council, a little over a week ago, you had your weekend planning session, and that included a discussion on the city's budget. And I think that that session demonstrated the complexities of the budget and financial situation, and furthermore, what's at stake for the community. It's become evident that new and different information is developing very quickly as cases change and as economic circumstances evolve, and in some cases have contracted. And because of the city's state of emergency, the council has the opportunity to consider an extension of the budget deadline, and by as much as 5 weeks. This would allow for more council review and analysis of all of the different inputs to the budget process. This would allow for more time to evaluate potential new federal stimulus. We're learning that perhaps another federal stimulus could even change the rules from the first federal stimulus, and there could be some considerations there related to timing. This would allow potentially for more time for the city to respond and adjust its potential budget related to changes in state policy and orders. Many of those state policies and orders have had economic impacts, and there could be a response and reaction to that. Generally, the fourth Monday on October has been the deadline for the adoption of the city's budget, and I believe that's likely intended so that the budget would be adopted before any council election that would change the composition of the council members. In this case, here in 2020, there won't be any change in that composition of the mayor and council, so that wouldn't necessarily be an issue. I think above all, and one of the things that was evident from the weekend budget session was that this will allow more time for public input. We have our portal and we're receiving information from the public and reaching out to the public for input as we go through this budget process in this unprecedented financial crisis. This 5-week extension of the adoption of the budget under an emergency would still allow for the adoption of the city's budget within Colorado statute, and appears to be overall in the best interest of the community. So it was staff's intention to present this as an option for council. I'm happy to answer any questions. And if it is the direction of council, then staff will prepare a formal action for your consideration at an upcoming regular meeting. So we provided a little bit of an overview here. You see it on the slide and in a meeting, in an email earlier, but felt that this would be a matter of due diligence for you to consider, and in as much as this will allow fundamentally, again, more analysis for you, Mayor and Council, more consideration and more input from the public. So again, happy to answer any questions and take your direction. Thank you.
And I know a couple of council members that asked for a short break, and as soon as we get through with this item on the COVID updates, we'll take a bio break. So if you can, hang around for just a couple of minutes. Mr. Demont, you have a question, and Mr. Seymour.
And Mr. Dorr, you had mentioned that this is typically done at a certain time before an election, but am I wrong in thinking that we usually do a 2-year budget and it's on the off year of our election cycle? I'm trying to understand that comment.
Oh, I beg your pardon, sir. Yeah, let me just address that, Councilor Demott. Yes, each year, I beg your pardon, the city charter, let me just start there, reads that the budget shall generally be adopted on the 4th Monday of October. And you're correct, in as much as it would typically be a 2-year budget process, the intention is, if it were, say, November 15th or November 30th, whatever the case may be, if there were an interim update to the budget, that could happen with the seating of a new city council. Also, I think the 2-year budget has been in place since the original charter provision for the 4th Monday in October. So those two things were put in place at different times. So, you know, I mentioned that I don't know exactly what the intentions were at the Charter Commission when that was brought forward, but I think it's generally intended to happen before any council election might occur. But at the end of the day, this is really more an opportunity for the council and the community to have greater input and more oversight and analysis into the budget, more dialogue and engagement.
I appreciate those comments. I mean, you bring up a good point, though. I mean, we're already looking at a 1-year budget, which pushes it into next year that we would be doing this exercise again, correct? And that's just something for council to keep in mind already. The other thing that I'm curious about is, you know, as far as some of the things that you had brought up as potential things that we could do to fix our budget short gap in the budget retreat. How does this affect those? And one other thing, and then these are my only 2 questions, and I'll pass it on if anybody else has any. I was under the impression we were under a hiring freeze, and I've seen some kind of what I would consider big dollar item jobs posted on LinkedIn recently for communications. Can we get an understanding of what exactly the hiring freeze is? My understanding is typically in these kind of situations, we would only allow hiring of like first responders, say, or critical jobs opposed to other ones. And so I was kind of surprised to see that posting in LinkedIn.
Okay, thank you. Yes, let's see. First, regarding the potential for city to have any voter approved revenue changes, certainly that could be an additional consideration for council. It could always amend its budget should it choose not to extend the deadline, but I would envision that council would probably have a couple more public meetings related to the budget, perhaps an additional public hearing to occur during the month of October and as traditional, and then perhaps an additional one in November with a November 30th adoption, that being 5 weeks from the traditional deadline. So something to consider related to that. And then related to the hiring freeze, let's see, we do have a hiring freeze with some exceptions, and I've reported on some of our hirings in our fire department and police, as you mentioned, but we've had a process. Our city manager's office is reviewing on a department level basis, inputs for the criticality of some of the positions. We have some 30 positions that are frozen at the moment, but we will hire for some, depending on whether or not they'll have a communication and engagement impact with the community. We've had some in revenue collection and just one or two areas where we feel that it's going to be critical for providing either service to the public or collecting critical revenue through this crisis. So I just want to asterisk that it has been a selective hiring freeze, and I hope that I've described it that way in the past.
Well, I guess two things, and again, I can pass it on, and this is just more my preference. As far as the pushing it out, I could be open to that, but I want to make sure that it's in the intent that we have more public engagement. So I'd like to see us back at City Hall, all of us. The other thing that I would mention is my preference is that if, you know, the situation that you shared with us that we're in, my opinion of some of these jobs that I've seen is that we shouldn't be hiring them right now. I would prefer to see, if I had 3 people who would support me in this, I would prefer to see, unless it's critical, such as first responders, that we're not hiring extra people right now. It just does not make sense to me. So thank you for your.
Mr. Seymour, and then Mr. Frankel.
Thank you, Mr. Mayor. I just wanted to mention too that back on the fact of an extension from the fourth Monday of October. I think the more information that we can get and that we can digest, the better for us. I'm not one to stray from the charter, but here again, this is an unusual situation. We need to gather as much data as possible. So I personally would be in favor of extending the budget deadline.
Mr. Frankel?
Thank you, Mr. Mayor. Dave Frankel, City Attorney. I just wanted to add to one of the questions that Councilor DeMott had asked regarding the charter requirement for the adoption of the budget. Just so that we're all on the same page. Charter Section 9.5 contemplates that the budget gets adopted not later than the second Monday in October, and that council may, by resolution, adopt the budget on this date, or may continue the matter to a date no later than the fourth Monday in October. So the charter does have that built in, and also there's a 9.5C, which contemplates the 2-year budget being an option. That appears in my copy of the charter to have been language that was added in November of 2000. So I don't know if it replaced earlier language, but it's clear that the 2-year budget is contemplated there in paragraph C. And to Councilor Seymour's observation, I would also share that, of course, this is an extraordinary circumstance we find ourselves in. So I think that we would definitely be looking to City Council for direction on this question.
Ms. Sykes?
So thank you. I want to make sure I understand this accurately. So basically, I understand what our charter requires us to do, or and what we would typically do. And so because of our emergency declaration, we're able to allow for a little more time to get some more revenue data, understand kind of the extent of COVID, and hopefully shore up some of our forecasts for what 2021 will look like. And additionally, we're able to get additional citizen input as to what services they see as critical and what their thoughts are. And I guess a little bit more time to communicate with our public what we're experiencing. But we are allowed to do this strictly because of that emergency declaration and the extraordinary situation that we're in. Is that correct?
Mr. Frankel?
Thank you, Mr. Mayor. Thank you, Mayor Pro Tem Sites. So the language in the charter, unfortunately, does not identify how the charter would be potentially stayed under an emergency declaration. If it is the will of council to make findings that would be very specific as to the reason that this additional 30 days was necessary. Staff would absolutely put detailed findings together for council to make a record on, and we would put that before council an agenda in an upcoming meeting. Whether that document went to council by way of a resolution or an emergency ordinance, we would absolutely recommend that very detailed findings be included to justify the 30-day extension. And I believe that the economic data that we are seeing now, the difficulty of forecasting under these conditions, and the need for public input would be findings that I would recommend be included in any council action to effectuate this 30-day delay of budget adoption.
Can I ask you a question? We, the charter also contemplates a 2-year budget. Would we have to do a similar finding for the single year budget? I mean, we're going to have to do that anyways. Is my understanding correct?
Thank you for the question, Mayor Pro Tem. The charter language specifically is nothing in this section 9.5 shall be construed to preclude council from adopting a budget for 2 fiscal years instead of 1 fiscal year.
Sorry, my misunderstanding.
It was opening the option. I don't know whether it had been the practice to attempt a 2-year budget before the year 2000, but for the last 20 years, that 2-year budget has been clearly authorized by the charter.
Okay, my misunderstanding. Thank you. Those are all of my questions. I will just say I agree with Councilor Seymour. I typically like to adhere to the charter and have that be the backstop for our decision making. But I do, we are in extraordinary times. I do think there's a reason we've made an emergency declaration, and I think I would be comfortable with stating those reasons and asking for that 30-day delay. Thank you.
Mr. Vols.
Yeah, thank you, Mr. Mayor. Most of my questions have already been answered, so I'll be very brief. I have a question for Mr. Frankel or Mr. Dorr. What is our statutory requirement for our budget? Meaning, what does the state require? Is it the 31st, the end of the year, the 31st, or is it some date prior to that?
Thank you, Councilor Vols. This is Larry Dorr speaking. This Colorado statute sets forth December 15th as the adoption deadline for municipal budgets.
And how much time do we have from the date we're pushing it back?
Well,
between that date and the date, how much? Help me figure that. I'm not looking at a calendar here. How much time do we have to finish up our budget then under that state requirement for the statutory deadline?
Thank you. That would be at the pleasure and direction of council, obviously. Just in our write-up here for tonight, I was thinking that the 5th Monday in November, November 30th, would extend for 5 weeks from the 4th Monday in October, and still allow a little bit of contingency time between then and December 15th, so as not to bump up against that statutory deadline. But and thinking that would give an entire additional month business cycle for all of us to evaluate and understand, and of course potential outcomes from state or federal legislation.
All right, thank you. And so it's your opinion we have plenty of time then in that time frame to wrap things up and have it wrapped up into the state by the 15th?
Oh, yes, and it would only have to be adopted by the city council by December 15th, and then there's a submittal period and so forth thereafter that allows for a bit of a grace period to submit the documents and all of those kinds of things. So yes, it was just really looking at the calendar, thinking about the opportunity for some more public input during a couple of regular council meetings in November. Perhaps additional council session, whatever may come to us in terms of the evaluation, and then a full month's additional sales tax collections, and landed on essentially that 5 weeks deadline, also considering the state deadline as well. So that seemed to be sort of the middle ground and perhaps the right date.
Okay, well, thank you for that answer. And I'm in a position to support the staff's recommendation. I think the more information, the more data, the more opportunity we have to communicate with the public, and then our residents as the public to communicate with us, I think is probably these very difficult times and kind of unique times for us. I think it's a good move, and I would support the recommendation as it's stated here. So thank you for the answers, and I would support this. Thank you.
Ms. Smith, would you like to wrap up this conversation?
Sure. Thank you, Mr. Mayor. Mr. Dorr, for the CARES dollars, does this have any kind of impact as far as the distribution of CARES dollars and what that would look like?
Thank you, Councilor Smith. No, I don't believe it would change the city's focus or activities related to CARES. We have our intergovernmental agreements in place and our programs reviewed by City Council and appropriations in place. We're working very hard to have an impact with CARES. I did mention it earlier in my description, in as much as there's some discussion and happening around the rules of CARES perhaps changing under a next federal stimulus, and this additional time for the city's adoption of the budget could present some choices for council and the community under such an extension. But it's certainly absent that, and even absent a later deadline for the adoption of the city budget, that would not change any of the direction that we're having as a community with CARES.
Okay, thank you. And I know that we're looking at major shortfalls of anywhere from 16 to 32 million. And so I'm looking at my notes from when we discussed at our strategic planning items to bring forth potential revenue and potential items to cut. And one of them was looking at interest rates and confidence that there would be some kind of stability in that as a revenue source. Do you feel that if we push back the budget even further, that it might stabilize more or become more volatile at that point?
I couldn't predict which way it might go by adding additional time, but certainly by having more time, the council and the community and our finance team will have an opportunity to have more information, more data. We hope that things will be more stable, and that would allow for a more precise forecast for 2021. Certainly, just in thinking back on the last 45 days, just how some of the things have changed and impacted our expected forecast, we realized just how fast things could change and how fast they have. So adding that time later in the year could prove valuable in the decision-making process.
Okay, thank you. And I know that that's really kind of hard to pinpoint, just even from a financial standpoint, because like, as you mentioned, it's kind of weekly, even daily sometimes. But then we were also looking at, and you may have mentioned this, and I apologize if I missed it, but items to potentially be placed on the ballot. I know that was a point of topic of conversation for a lot of us, that staff would be coming back to us for further information on that, such as, I believe it was property tax, and looking at marijuana in Westminster. So could you walk me through what that process would look like? Is staff still planning to come back with more information? Is that off the table? Is it still on the table? What does that look like for pushing back a revenue deadline of getting it, I guess, approved by December 15th?
Okay, thank you. Let's see. First, just to recount the direction that was that of council from this past July 26 was for staff to pursue input from the public via survey as to the potential for changing revenue sources. And we've been working hard on that since that Sunday, a little over a week ago, and designing some survey questions with input from some professionals. And that's still in development, but of course we made a commitment to share those survey questions that the consultant would outline for council to see, and we're still a little ways from finalizing that. But when that's done, we'll certainly be sharing it with council and sharing the results, of course, with council. But setting aside whether or not any of those questions may be referred to the residents for vote or not, or what the outcomes of those things may be, there will still be this core challenge, this core financial challenge of revenues, whatever they may be, impacted by the economy and in this current crisis, and then also matching up the city's expenditures, capital projects, and consumption of reserves. All of those things mixed together with public input and analysis by council, setting aside any revenue change, suggests more time might be useful in that process. So I don't think that they're interdependent or necessarily immediately related. Of course, if a change was offered to the residents and it was voted up, that could create some additional work in the budget as well that could be completed before a November 30th adoption.
Okay, and so then, because I believe that we have a another, I don't want to call it strategic planning, but another budget session in September, and then is that something, because I feel like, I guess my concern is that I felt, and I don't know if this is because I'm new on council, it surely could be, but I felt that after our strategic planning session, not this weekend, but the past weekend in July, that we got information as far as the budget, and I felt like we haven't had an opportunity to really dive into what we would be focusing on for cuts, and really focusing on that shortfall part of it. So I guess my greatest concern is if we push this back even further, will that allow us time to look at in depth what we really need to do as a council and as a city to narrow that gap that we're looking at. We already know we're at 16 to 32 million. You know, it could be bigger, it could be smaller if we push it back 5 weeks. But I guess my biggest concern right now is that I feel like we've gotten nowhere as far as reducing this gap and figuring out how we're going to focus on this as a city. So you know, if we come to a majority as far as pushing this back 5 weeks, then I will defer to the majority. However, I don't want this to draw out any further as far as our planning, as far as what we need to really dive into on cutting, because I fear that unfortunately we're going to have to cut. And much to like Councillor DeMott's ask of where are we at with hiring freezes, I know that you mentioned that we have a hiring freeze, and it will be saving us $1.4 million in its entirety. But I'm not quite sure if that's enough. You know, when we look at critical positions in Westminster, is it what are we considering critical? Or is it positions in a city manager's office? Is it positions in our police department? Is it positions in public works? So that's really what I'd be looking at. I've said it in strategic planning that a small analogy is looking at a personal budget. You can only do what you have in your budget, right? You can't go outside of that. Otherwise, you're going to be in a massive amount of debt and you're trying to get out of it. I still stand by that on a larger scale for our community. So I defer to the majority of the council, but I'm cautious as far as moving forward with pushing back a 5-week extension as far as finalizing our budget. Thank you very much.
So Councillor Smith, this is City Manager Tripp. I'm going to jump in here. As City Manager, I have the responsibility to provide you with a balanced budget. Our intention is to come back to you in September after spending every day until then looking at the revenue and looking at the expense opportunities we have for savings in 21, and bring you options to balance that budget. We're working on that now. You ultimately will make those decisions, but to be clear, yes, certainly this is coming back to you, but we need some time between now and then to look at those options. There's been on a couple occasions tonight a mention of the presentation regarding potential budget reductions that was made 2 weeks ago. That list that we provided was not just a 2021 list. That list included many items that there's no time to even consider as a part of a 2021 budget, but will be looked at over a longer term for what we project to be potentially a 5-year shortfall. So to summarize and to be really clear, you're going to get from us a balanced budget recommended to you, and we'll be attempting to line up with the core services that we have in the city and to have those financed for 2021. And at this point, I can't tell you exactly what that's going to say, but it would come to you in September with feedback. And then I think the time that the finance staff has asked for here that's extra helps all of us. It helps all of us to assess that information and also present it to the public and get feedback. The other thing I want to say, just to be really clear, we were asked to bring back the questions for the poll. It is not our intent, because we haven't written the questions. The questions are going to be written by a firm that is expert in this. It's our intent to cast a broad net to get you as much information as possible, so you can make a final decision for this year or in even coming years as to what some of those priorities might be for people's willingness to increase revenues. So thank you, Councilor Smith, for your questions. You always have thorough ones and good ones, and I appreciate it. But you can rest assured when we come back in September, we're going to have those options for you. Thank you.
All right, ladies and gentlemen, I'm going to poll the council and I'm asking for a yes or no answer. The question that before you is, will you support the staff recommendation to push the council budget proposal as a final by 5 weeks? And that allows them to get more time, get more data, and being able to give us and the public as well additional time to look at the budget. So I'll start with Mr. DeMott, yes or no?
I'm a yes, but I would ask that we continue to do our best to be back in person before we adopt this.
Ms. Seitz,
I'm a yes.
Ms. Scully,
I'm a yes.
Ms. Smith,
Cautious yes.
Mr. Seymour,
Yes.
Mr. Voles.
Yes, as I said earlier, I support the staff recommendation.
All right, the mayor as well. Council has determined that we will accept a 5-week push in the budget process, and that we'll still try to get as much as we can accomplished between now and the end of the time that we have to adopt this budget. Ladies and gentlemen, we've had an extensive amount of time. Mr. Hall is going to defer from his report tonight. At this point, it's 8:22. I'm going to ask everyone to be back on the line by 8:30. We will take a short bio break. At this time, the council is in recess. All right, Ms. Parker, can you confirm all the council is back?
Certainly. Mayor Atchison,
Yes.
Councilor Demott,
Yes.
Mayor Pro Tem Sites,
Yes.
Councilor Seymour,
Yes.
Councilor Scully,
Yes, ma'am.
Councilor Smith,
Present.
and Councilor Bowles.
Yes.
All right, council, moving on to item 2, the Human Services Board funding recommendations. Mr. Presner, I believe you have not only your presentation, but the chair of the board here to talk about this.
Yes, thank you. This is John Presner, Policy and Budget Analyst. I have Katie here with me, who is the chair of the Human Services Board, who's going to give a quick overview of our grant process and our funding recommendations for 2021. Katie?
Thanks, Sean. Good evening, Mayor and Council. And I won't take too much of your time. Obviously, it's already been a long evening and you guys have much more to do this evening. This year, we received $203,910 in requested funds for the grant money. And we were able to look at all of the applications from each of the applicants and determine an amount for each of them to get to the $130,000. We did have 2 new applicants this year. One was the Denver Hospice, and as you all probably know as city council members, they are opening a location in Westminster, and so it was nice to see them apply for the grant this year. Additionally, we received an application from the Outdoor Lab Foundation, who provides the outdoor experience and services for, I believe it's 5th and 6th graders in Jefferson County, looking for some additional funding and support to help ensure that low-income families would be able to access the program. What we look at based on council's direction is food, health, mental health, and housing as priorities. And in the last couple of years, we've really kind of focused in on food and housing, given the local area needs. As we review the applications, we look to see the number of residents served, and if they're unduplicated services, how they collaborate and leverage their community relationships. And we also make sure they've completed the previous report. Some of the other things we like to talk about and look at when we look through the information is any data they provide on the effectiveness of their services, and that they are able to tell us, what progress they've made, what successful outcomes that they've had. We also look at how much of their funding is made up of what the council or what we provide through the grant program. So for some of the organizations like FISH, it's a considerable amount of money. And for others, it's just a small portion, and it really benefits them to be able to say that the city supports them in their services and their programming. So I believe John provided you with a list of each of the programs and the amounts for your guys' review. And if you all have any questions for myself, I am happy to answer those.
All right, Ms. Rush, thank you. I have one council member who's had a comment, Mr. Voles.
Yeah, thank you, Mr. Mayor. And first I want to say, Katie Ruski, thank you for being here tonight. I appreciate it. And I just want to say, as City Council liaison to the Human Services Board, I have a front row seat to see the really great work that this board does. And it should make us all proud. They work very hard. When these applications come in, there's a very set deadline. They work very hard. They work very cohesively as a team, and it's fun to watch. And so I just want to thank Katie for being here and for her leadership, and as chair of the board, and then also all the members who do, they volunteer and dedicate their time to this outstanding project. And I think they've really settled on some I think the funds they've settled on are appropriate, and some really good organizations applied this year, as Katie mentioned, 2 new ones. So thank you all for your work on the Human Services Board. Katie, thank you for your leadership as chair. And Kathy White as vice chair, I really appreciate everything you guys do. I just wanted to make that comment and thank our colleagues and our fellow residents who serve on the Human Services Board for all their hard work. Thank you. And I hope we can all support this, and I'll leave it to questions. I don't have any questions. I just want to make those comments. So thank you all, and thanks.
Ms. Sykes?
Thank you, Mr. Mayor, and thank you, Katie. I have to agree with Councilor Voles. I am a former liaison to the Human Service Board, and really know the level of effort, work each member takes in taking limited dollars and trying to stretch them as far as they can. It is not easy to not fund the full ask, and those are some pretty hard decisions when everyone's worthy and serving an important population and an important need. So thank you for doing it. I appreciate your dedication and your diligence. To any members of the nonprofit community that are listening in tonight to see how we receive this, I just want to say thank you for serving our population as well. I think the need is going to go up in the next few months and probably the remainder of the year. We are seeing unprecedented hardship during this financial crisis caused by COVID. So thank you. You are a necessary part of the tapestry of our community, and you're so valued and your work is appreciated. And thank you to Councilor Voles for serving as the liaison, the eyes and ears back to council. He is very proud of the work that Human Service Board has done, and does not cease in letting us know how much he appreciates you. So thanks.
Ms. Scully?
Thank you, Mr. Mayor. I basically am jumping on the bandwagon with my fellow councilors in thanking you, HSB board, for all the work that you do. It's incredible, that amazing. I too have been a liaison to that board, and I'm always very struck by the integrity and the willingness to try to share the funds as equally as possible, but recognizing that we can't fund everything. And so I just appreciate that hard work and understand all the work that goes into that. And I am particularly excited about giving some funding to our outdoor lab. I am an alumni of Outdoor Lab on the Jeffco side, and so are both my children. It is truly a worthwhile experience, and I just appreciate that we were able to do something to help out this year. So thank you for all your hard work.
Are there comments from any of the council members who have not spoken yet? Seeing none, Mr. Voles, would you like to wrap up the council comments, please?
I sure would. Again, thank you to my for Mayor Pro Tem Seitz and Councilor Scully. Those were great comments, and I appreciate that. I also should have said earlier, and I didn't, so I want to come back on just briefly and say, we had excellent, tremendous staff work on the part of John Presner. He works as a policy and budget analyst, but he also is a staff liaison to this particular board. And I can tell you that he did tremendous work and worked as hard as well. So I want to thank him for supporting this board the way he did. And this is his first year to do it. He's new to staff, or relatively new, and I think he did a fantastic job. So thank you for that.
Our council, the staff is looking for an approval of the recommendations of the Human Services Board. I will try to cut this one short. Is there any member of the council who does not support the recommendation of the Human Services Board funding? John, I'm seeing no one that has any objection to the recommendation of the Human Services Board, so I would ask you please to move forward with that item.
Thank you. And I just have one quick comment, Mayor, on a related topic. The Human Services Board also did open up a special grant program for COVID-19 related expenditures. They are scheduled to meet tomorrow to review applications, and we plan on having those recommendations finalized this week, which we'll present to the council next week.
All right, thank you very much. So for the one you have right now, John, the Human Services Board, please move forward with that one.
Thank you.
Mr. Tripp, who do you have in line for item 3?
folks who are with you right now. Larry Dorr and Chris Lindsay, please.
All right, gentlemen, if you would, please.
Thank you, Mr. Tripp. This is Chris Lindsay. We have the city council's, at least our first version of a proposed operating budget for city council. There's a grouping of items that are contained within the city council's budget that have to do with operating costs incurred by council every year. Items like salaries, conferences, mileage, phones, community sponsorships, and several other miscellaneous expenses. Staff has prepared a first draft of that information for City Council's review this evening, and we would appreciate any and all feedback on that. I would add, in light of the discussions recently about potential impacts to the budget due to COVID-19, we would appreciate any direction from council on potential reductions into the operating budget, if council would feel comfortable providing any this evening. And with that, I would open it up for council feedback.
All right, council, does anyone have any comments? Ms. Sykes, go ahead.
So thank you. I do. Looking through this budget, it just kind of amplified for me the hard choices that we're going to have to make, you know, as we look at the 2021 budget in its entirety. And so I think while our budget as council is incredibly small, I think that we need to probably step forward and look for areas of savings. My initial thoughts is I would not like it to come from the different organizations we support through the council budget. Oftentimes, you know, they count on us, and during times of financial crisis, they see their revenues dry up. So I would like to retain that, but perhaps from some of our education funding, our dinners, I'm thinking I'd like to take my colleagues' temperature on this, but I think we should look for, you know, 10% savings or something if we can from council's budget. And I'd like to hear from my colleagues on their thoughts on that.
All right, Ms. Scully.
Thank you, Mayor Pro Tem Sites. I totally agree. I think that we should look for a 10% decrease. I would very much like it if we could not dip into our nonprofits, if it was at all possible, and do the decreases from other areas, including, and I'm going to throw this out there, but in light of the situation of our city, I would even be willing to sacrifice part of, if not all of my salary for serving on the city council. I think this is a dire time for our city, and it really demands appropriate leadership and willingness to serve without consideration of our personal reimbursement. I think this is a time that is important for our city to know that we support our city 100%, and we're here to serve, and we're here to be leaders. And so I am willing to take any cuts that the city suggests. Please do this. I think this is really important.
Ms. Smith.
Thank you, Mr. Mayor. I'm looking at the budget too, and I can't add, I also can't add to our budget when we're asking to cut in other places. So I would be supportive of cutting in just many areas that we could think of. Again, I'm not sure that I would want to cut back on the donations that we've give to our schools and to our nonprofits. I think that's important for us to make sure that we try to have a commitment to. But I agree, I don't think that we should be increasing our budget in any regard. So I'm anxious to look at what we could cut for council. Thank you.
Mr. Vols.
Yeah, thank you. Thank you, Mr. Mayor. And I think Mayor Pro Tem Sites said maybe we look at a 10% cut, and if staff can help us identify that, or if people have suggestions, we can get to that. We do need to set an example here, and I think the example would be that we do reduce this budget. And I think this is one of the first budgets we're looking at, and I think some reductions are absolutely appropriate, and I would support that. I would hate to see us, excuse me, to delve into our support of organizations as we do throughout the year. I think some organizations really rely on that. If there are events that are defunct and no longer happening, I would support that. But other than that, I think most groups can you rely on our support. And I think it shows a good signal from us that we do support their organization. So if possible, I would like to leave that alone. But wherever we can, I think, a 10% reduction in our staff, if staff can come back or if someone can come up with that, I would greatly support that. Thank you.
All right, I want to continue to go to those who have not spoken first, then I'll come back to those who have already had a chance to speak. Mr. DeMott.
Thank you, Mayor. I support reducing. I think some of the areas that I would put forward to reduce is obviously, I don't see the need for us to do the trips. That is in the budget to do the NLC career development. Some of the meeting expense items I think we could do away with. I don't feel that we wouldn't be able to figure out how to get food for ourselves. If we get to go back into in-person meetings, I feel like we probably saved some money this year since we haven't been able to meet in person. If there are any events that are dinners that maybe we could reduce those areas, the different galas and stuff, and perhaps instead of paying for a full gala, we could just do a straight donation in a decreased manner, because that way the organization's still getting what they would net for, say, a dinner if we're just giving a straight donation versus buying a table for something. So I think that there's room to do some cuts in those areas, and I do think it makes sense, as Mayor Pro Tem Seitz stated, for us to go first in that. And so I think those are some areas that I definitely think that we can have some savings on.
Mr. Seymour.
Thank you, Mr. Mayor. Councilor DeMott took the good ideas right off the table, along with my other colleagues. I believe too that if on the banquets, most of these are going to happen virtually, and so if we could give the net amount, a lot of that being associated with a couple of those in the past, I know it's a substantial cost to fund the banquet itself, and we could actually still drive money to their bottom line by cutting out what would normally be the cost of the food in the venue. So still give to them without hurting that. And the travel, I agree, is probably going to be off the table. I think just by doing that, we are going to net more than 10% if my quick math is correct.
Any other comments from those who have not spoken yet? I think I got just about everybody. Before I start again, Council, I want you to refer to attachment B, page 5. I'm going to give you a couple of easy ones. The Westminster Legacy Foundation wine tasting event, which typically garners $5,000, that event was not scheduled to happen this year. The foundation lost its sponsor on that, and they were not able to identify another one. I spoke to the chair as late as around 2 this afternoon. They will not be doing that in 2021 either. So there's a $5,000 savings off the top of the list. On page 1 of attachment B, the Adams County Economic Development Authority that was previously there is no longer. Adams County Economic Development morphed into something else. And this luncheon sponsorship, to the best of my knowledge, is off the table as well. One of the things that we need to look at, we've had an announcement that we can consider this as we go through the budget exercise on page 2. The Butterfly Pavilion has announced that they still plan to leave next year. So I would think that that would potentially be something we would reconsider in attachment B. Going to attachment A, we have a responsibility to make sure that we're only paying for the things that we need. And I'm going to recommend also that in the career development area under the US 36 other lobbying effort, the $2,500 be removed. We already have a set of lobbyists that report to the city. that is already in the same meetings that the 36 groups lobbyists are, and I don't see any reason that we should pay duplication of having 2 sets of lobbyists in the same meeting for a portion of what we're already getting from the people who have our full-time piece. So I'm going to recommend also that we remove that from the 36 group. Other than that, there were no specific items that I found that don't need to be at least looked at. But some of those are low-hanging fruit that we can cut pretty easy because they don't have the requirement for those activities any longer. If you have any other items that you want to discuss, we'll go back around one more time, see if anybody has any particular items that they want to do. But I think, as Mr. Seymour said, there's a couple of those that we can do like that with travel, some of these other groups. Then we could potentially get our 10% without a lot of hurt to our nonprofits. Ms. Seitz, I had you in the list, but I finished up with everybody going through one time, so you're back up for round 2.
Thank you, Mr. Mayor. I had a question. I believe at the strategic planning budget retreat, we talked about the fact that one of the areas that staff was looking at for savings in 2021 and the remainder of 2020 was freezing travel. Was that correct? Was that for both 2020 and 2021 for trainings? Is that correct?
Mayor Pro Tem Seitz, we discussed that in terms of 2020 measures. I don't believe we've yet made a call for 2021.
I'm a big believer in going to National League of Cities. I think it's great to learn about best practices. But I think in this situation, I would be comfortable with us suspending our out-of-state travel for events for a year, particularly if that's something that the broad employee community has been asked to do. And I realize you were only thinking of it for 2020, but I would not be surprised if that or a portion of that gets extended into 2021. I would rather not cherry pick specific events because I think most of the events are probably not going to happen in the way that they did before, but that we still are going to support the goals of the Legacy Foundation. We're still going to support the goals of ACREP. I don't know if it's ACREP or how they pronounce that acronym. So I don't know if I necessarily want to say, let's take money out of the different nonprofits that serve Westminster. Similarly, I am a little bit, well, I'll just say I'm against us pulling out of the US 36 MCC. Reason being, I believe that there might be stimulus and stabilization dollars that comes in the form of infrastructure projects. And up north, we have not had as good of success as they have in the South, lobbying often for transportation projects and dollars. And when we have, actually during a former round of stimulus, it was because we had alignment with our neighbors. And that was the US 36 MCC that really assisted us with the redevelopment, lobbying and getting the dollars for the redevelopment for US 36. And so for a very minimal cost, while I do agree with the mayor, there's duplication, and maybe we amend our contract lobbyists, to maybe they aren't as involved with transportation. But I do think that we should stay on board with the US 36, if for nothing else, engendering goodwill with our regional partners. There's a lot of issues that are going on right now. The RTD Accountability Committee wanting to make sure we have regional equity in RTD dollars. That's an issue we have not had in the North. Everyone is still stinging from fast tracks. So it seems like a small ask for the potential of having that regional alignment. So I would recommend that we stay there. I found it interesting just even attending the meetings as the alternates, meeting the different community members, the different mayors, mayor pro tems that attend, and kind of building that regional collaboration has been really helpful, I think.
Ms. Stites, let me clear up one thing. Taking away the budget money for the lobbyists from the US 36 has nothing to do with anybody recommending pulling out of 36. That's funding an activity that we have a duplication of effort on. nothing more.
Right, I'm just saying it might not engender goodwill because that's how they pay for their lobbying efforts, is by everybody putting in. And I know that there was already some tension with us pulling out. We're the only ones that didn't contribute to the federal lobbyists. So you don't want people to perceive that you're getting a free ride.
And I would tell you, we have to maintain our budget regardless what the others do. Mr. Voles, you have a comment?
Yeah, I do, Mr. Mayor. Thank you. I'm hearing a lot of comments here, and I think it sets good direction for staff. I want to make a proposal for the sake of time and being efficient for our meeting this evening. Would it make more sense to have staff take a look at all of our items? And we've all made comments of things we think, and then collect all that information, take a look at the budget, low-hanging fruit, let's knock that out, and then maybe have staff come back with the recommendation to hit 10%, 15% reduction, and we can take a look at that. Because I think what might happen is we're going to each individually have this and that and the other, and then get mired in details. Maybe we instead have staff come back with a proposal for us based on a 15 or 10% reduction based on what we have in these two attachments, instead of us doing it line by line tonight. I guess I would ask colleagues if anyone agrees. Thank you.
Mr. DeMott.
Thank you, Mayor. I don't mind them coming back. I think very specifically, it sounded like we had a good consensus around the travel and the events that are training. So I feel like you're going to get pretty close to the 10% with that. And then maybe they could give other recommendations on events where maybe they're dinners versus just giving a straight donation. The other thing that I would like to support Mayor Pro Tem Seitz in her request about the US 36 group. I know that when the last time we did the budget, we had the same conversation, and now I agree with her as far as the value there. And I think that it makes sense for us to continue to be part of that, because long term it benefits us. And I don't think for the amount of money that it is, that it's worth pulling out of. And I know that we've had that conversation before, but I wanted to, since I was here, and I think we had almost a whole different table besides four of us. So, but I do recall that conversation, and it makes sense from my perspective that we do as Mayor Pro Tem Seitz said on that group.
Ms. Scully.
Thank you, Mr. Mayor. I would support what Councilor Bowles has recommended. I agree. I think we've had a lot of conversation. Let's have city take a shot at it and then bring it back to us.
Other comments from council? All right, Mr. Dorr, Mr. Lindsay, you've had some feedback. We'll be looking for your recommendations.
Thank you, Mr. Mayor. We will come back with recommendations.
All right. At this time, it's approximately 8:58. We're going to need to adjourn from this meeting. We will reconvene shortly as the Westminster City Council for an executive session. But before that, Mr. Frankel, would you like to discuss what we're going to be doing?
Thank you, Mr. Mayor. Dave Frankel, City Attorney. The executive session that's proposed this evening is to consult with the City Attorney for the purpose of receiving legal advice concerning the status of litigation in the ongoing IAPMO and ASSE versus City of Westminster case pursuant to CRS 246402 4B and E1, as well as Colorado Revised Statute, excuse me, as well as Westminster Municipal Code Section 111.3C 3 and 7.
Council, you've had information provided by the City Attorney's Office on the request for an executive session. At this time, I will poll each member of the council to see if they are prepared to go into executive session. Once that is determined, then we will adjourn, and then you will come back into a different meeting, which will also remind you need the password to get in as well. So at this time, all those who are prepared to go into executive session, I will poll the council. This is Mr. DeMott.
Yes.
Ms. Seitz.
Yes.
Ms. Scully.
Yes.
Ms. Smith.
Yes.
Mr. Seymour.
Yes.
Mr. Voles.
Yes.
And the mayor is yes. It's approximately 8:59. We will reconvene at 9:05 in the new meeting under an executive session. At this time, we are adjourned for the evening on the public meeting.